Hey everyone, it's DrRic. So I am talking about menopause tonight. This tutorial I'm going to try to keep it concise, but I'd like to have you refer to the previous lecture I did. I did a Q&A, or at least, a minute clinic on PCOS. Now, the two kind of mimic each other, except PCOS is turning on too much crap. Menopause is turning off a lot of crap fast. So in the case of menopause, which usually hits it's supposed to hit most women in their early 50s, late 40s perhaps, but now I'm seeing a lot of people in their early 40s. I have a couple of female patients that are actually late 30s. And that's how, I don't think it's that we have these estrogen lookalike. I think that the estrogen lookalikes that are in our plastics and our foams and some of our foods, I think they're not good for you, and they're probably going to be proven to be unhealthy, especially when the toxic burden on the body is way too much. I think it's a multitude of different things: stress, increased weight gain, probably indulgence of things that we shouldn't be eating, in addition to the exposures like I talked about, poor sleep, lack of exercise. So there's a bunch of different things, and then there's genetics too. But there's a bunch of different things that control or speed up the diving into menopause. I am going through hot flashes at night. That's considered andropause. When the testosterone goes down a little bit, sometimes you'll feel it with regards to hot flashes, difficulty with losing weight, sometimes erectile dysfunction. And when my guys really drop down, they'll definitely have erectile dysfunction, be depressed, get heavy, the muscles will start to atrophy, you have hair loss, and then there's a couple other things that occur too. Prostate gets big. So when women go through menopause, usually what happens is as time goes on, 30s, 40s, 50s, suddenly there's a decrease in the estrogen, and I'll talk about that right now. With guys, it's just gradual. So it's not fair, but that's just the way it is. So in the case where you are a woman and you're having menopausal symptoms, whether they're hot flashes, vaginal dryness, difficulty with mood, instability, weight gain, difficulty with losing weight, muscle atrophy. So all these things could be part and parcel of that. But if we kind of go through it here, I should be able to understand it. I'm not going to make this too scientific, but this is essentially the same. This is the same chart that I use for PCOS. And it's essentially on a time basis. This is from day 1 to day 28. That's the usual monthly cycle. The beginning of the cycle, day 1, is considered when you start to have your period. And then you end the period, that's down here, menses. And then so goes the first half of the cycle, which is called the follicular stage. And then you have the luteal stage, or secretory stage. Now, I'm going to just go through this briefly, because if you understand this, then you'll understand why estrogen happens, or why menopause happens. So when you're young and you have cycles every month, that is because of something that happens in the brain. The brain, this is the timeline down here as time goes on. This is the hormone level on the side, so that you can see your X and Y axis. Here is hormone level here from the ovaries. This is hormone level from the brain. The brain is the master organ that sets off the pace. Right here is the uterus and an ovary. So what happens is the brain and its hypothalamus, that's the master regulator of several different things, including temperature. It sends a message because it releases something called gonadotropin releasing hormone in pulses. It pulses this hormone, and it pulses it depending on the feedback it gets from the rest of the body. But when it pulses, it's gonadotropin releasing hormone. FSH and LH, two hormones, are released from the pituitary. It's a brain right in the middle here, a part of the brain that's in the middle. The pituitary releases FSH, which is this orange line, and then LH, which is this red line. Hopefully you can see that. FSH is the orange light. There's a little blip, and then a little blip here, and then it goes through. And then LH, luteinizing hormone. FSH is follicle stimulating hormone. LH, luteinizing hormone, stays quiet, and then spikes right here. This is called an LH surge. Excuse my handwriting, but the LH surge responds to, I'll show you what happens. When LH and FSH start to be secreted by the brain, the pituitary, it stimulates this ovary. The ovary is where you have eggs. Let's call them eggs. They're called ovum, but you have a bunch of different eggs, about 400 or so for life. And every month you let go of an egg from one side, one ovary or the other. Now, when the ovary gets the stimulation from LH, luteinizing hormone, or FSH, follicle stimulating hormone, it starts to grow. They're called primary follicles. These tiny little dots start to grow a little bit. And secondary follicles start to grow a little bit more. And then one of these follicles it's the lucky one, gets to be the one that develops. And once this one develops into a tertiary follicle, all the others quiet down. That's how it's supposed to happen, one egg at a time. Supposedly because this one has receptors for LH and FSH, the most sensitive for that time of the month and that cycle of the year. But it grows, and as it grows, it starts to secrete estrogen. And I'll show you this in a second. So just remember that when the LH and FSH go and it gets secreted, the ovary stimulates one egg, and that one egg is this guy. So this is an egg, just like you saw up here. It came from the ovary. I just eliminated the ovary here. There's one single egg, and the egg has two layers around it, just like egg white and egg yolk. Well, the egg outer surface is called the theca. The inner surface is called the granulosa. Those are two layers. The LH and the FSH that come from the pituitary. The LH stimulates the outer lining of this ovum to secrete androgen. So LH comes from the brain, tells the egg in this one single ovary, secrete androgen. And androgen is made. Androgen is, just think of it as testosterone, male dominant hormone. And you wonder, well, this is a lady. Yes, it is. But here's what happens. The FSH stimulates this inner layer called the granulosa. The granulosa, it actually takes the androgen that came from the outside, produces it into estrogen, and that's where your estrogen comes from. So estrogen comes from this little egg. So going back to our cycle, this one single egg starts to produce estrogen, and you can see right after this LH surge, estrogen spikes. This is the amount of estrogen over time. It spikes, and supposedly it causes the LH surge, or the LH surge causes the spike. But either way, you have two hormones, a brain hormone and an ovarian hormone spiking around right before the 14th day. And when the LH surge spikes, it releases the egg, or the ovum. That's what this is, egg launched. If you can't see that, egg launched. So, at the 14th day, you have ovulation. And that's supposedly the time of life when you get the pain on the sides of the belly, because it refers to when this ovary lets go of an egg, it lets go of blood, and blood sometimes will irritate the pelvis down below. And if it irritates the pelvis, it can actually cause pain, crampy pain, abdominal pain. That's from the blood irritating the lining of the pelvis. It can also hurt just from the ovary because it launched like a big pimple. And if you ever popped your pimples on your face, I know some of you have, it hurts for a while. So when the ovum is launched from the ovary, when the egg is launched from the ovary, see the smiley face? Then you have the leftover remnants of this developing follicle turn into something called a corpus luteum. So this is where the cool thing happens. Corpus luteum actually secretes progesterone. Progesterone is your second hormone. You got estrogen that comes from the ovary as it's developing. Remember, in this picture, secretes its estrogen, secretes its androgen, then secretes estrogen. And then progesterone comes from the corpus luteum. So progesterone is responsible during the luteal phase, as this egg is going to meet up with the sperm and then in the fallopian tube, and then it travels to the lining of the uterus and implants. Well, you need a thick lining and a friendly lining, and that's what the progesterone is for. Secretory phase is supposed to secrete lining, thickness, columnar cells, mucus, so that you can have the egg with a sperm and technically an embryo attached to the inside of the uterus. And there you have implantation. And usually if there is implantation, the corpus luteum and the placenta and other things continue with progesterone, and there you have your baby. Now, if you don't have implantation anywhere around this stage, sometimes what happens is the corpus luteum dies. And when the corpus luteum dies, no more progesterone. When progesterone tails off, you have the progesterone tails off, the estrogen tails off, hormones from the pituitary are quiet. That's when you have no support to the lining of the uterus and menstruation. And that's your cycle in a nutshell, right? Hopefully that wasn't too hard to understand. So that's where this estrogen is really handy, because when estrogen is around, that came from androgen, you usually will not have a hot flash. Now, in the case where you have, say you're in your 50s, you've launched a lot of eggs. Some of these follicles will develop and have the potential for an egg every month. Some of them will just die as a small cell. But after a while, if you look at this, this is an older ovum. And the older ovum has no more, just say that it doesn't have any smiley face anymore. There's just an ovum, if there is any ovum. Now the brain, when it secretes its usual cycle, it starts to secrete over here, LH and FSH, thinking, okay, let's go have another egg launch again for this month. Well, if you're out of eggs, there's no launching. If you're out of eggs and there's no launching, the brain's going to say, well, come on, what's going on? We need estrogen to launch. So it's going to push, instead of this LH surge, remember the LH surge from the pituitary, also happens at the same time as the estrogen surge from the ovary, and everything's cool. Now when the ovary's not kicking in because you don't have any more eggs, the brain's going to say, well, we can't launch an LH surge, so might as well get more and more FSH around, follicle stimulating hormone. So when the brain senses there's no ovary launching an egg, no estrogen, it's going to say, okay, I guess the ovary didn't hear us, so the brain goes louder and it secretes more FSH. When you have a lot more FSH and a lot more LH, usually what will happen here is you'll see a spike of FSH over here in the beginning. And it's not supposed to do that, but the brain's trying to fight for its life by saying, we need to supplant the species and have it keep on living, so let's really stimulate and tickle that ovary to launch something. And obviously the ovary doesn't have anything left. So if the ovary doesn't have anything left, there's not going to be an answer. Brain will just continue to secrete FSH, follicle stimulating hormone, from the pituitary with no answer. And the bad thing is when the brain has to constantly, from the hypothalamus, stimulate GnRH, gonadotropin releasing hormone, we need more FSH, we need more FSH. Well, because of that being so loud, other things happen. And the hypothalamus, which is a master gland up here, is going to go a little crazy. And guess what else is in the hypothalamus? The thermoregulatory center of the body, the temperature center of the body. So imagine if your kid was downstairs and playing with the thermostat. He'd turn it up and turn it up and turn it down and turn it up. He gets a little bit cold because he takes a shower. He turns it up and heats up the whole house. And then he gets too hot and sweaty in his blanket and he turns it down and cools down the whole house. That's too aggressive. Well, that's what's happening with your brain and your hypothalamus and your pituitary. It's trying to fight for its life, for the species, because there's not enough egg. There's not enough, if there's no egg, it's not going to make any androgen because the theca isn't going to respond because there's no egg, and the granulosa is not going to respond either because there's no egg. So no androgen, no estrogen, more FSH. Again, more FSH. So that's why you'll run into problems with, number one, you can find that if you're a doctor, just do an FSH-LH level, a blood test, sometime in the beginning of the month, or actually any time of the month, and you'll see it just spike up and it'll be obvious. But it's more obvious than that. That's just a plain old test, blood test. You can see women come in, they've gained weight, they're sweaty when you talk to them, they're going like this, they're very moody, they're complaining that sex is painful. Not only is the vagina dry, but sex itself is painful because the perineum, which is supposed to be a very plump muscle, responsive muscle, sensitive muscle, it's very thin because there's no estrogen. Kind of like a guy, that's why we shrivel up. Not only the penis, but we shrivel up and muscle is lost. So one of the best things with bioidentical hormones for guys is that testosterone can be used if you want to postpone your andropause. So what I usually give my guys is, it's not going to be indefinite, but I say, okay, if you don't like the way things are going, I want you to lose weight, I want you to build up muscle, I want you to get to a lean body and get healthy. Get some good sleep, but if you can't do it now because your testosterone's too low, well, I'll give you testosterone, I'll make you feel like a 20-year-old, you have 6 to 12 months to do it because I'm pulling you off after that. I don't threaten like that, but I don't think you should be on HRT forever or bioidentical hormone replacement therapy forever, or if you want to be technical, testosterone replacement therapy forever, because I think you can maintain with it proper eating, mostly whole food plant-based diet. I've seen some ketos do this too. No junk food, no sugar. But sorry, I don't mean to be talking about guys, but it's the same thing. It's a little bit of a different, we don't have a menstrual cycle, but we still have ebbs and flows. And the brain still asks the gonads to work, and when the gonads don't work, male or female, you get in trouble. Now, until you get used to it, and then you enjoy it, and then you're okay. But if you go into that time period, what I was getting at, if you go into that time period and you're male and you're healthy, low body mass index, exercising every day, eating good, you shouldn't even feel it. So there's other things that compensate, thyroid and adrenals, but we'll get to that in a second. If you're a woman and you have suddenly embarked on all these hot flashes, difficulty with concentration, moodiness, difficulty with sleep, weight gain, painful vagina, then one option is, and we'll talk about the options now, one option to take care of this low FSH is to give estrogen. And then this is where the controversy lies, because the Nurses' Health Study came out in the late 1990s, and it was essentially in support of using estrogen to prevent heart disease, stroke, in some cases blood clots and other things that kill you. And then, because it was more of an observational study, which has its value but it's not as accurate, the government, the NIH, went on to do a WHI study, Women's Health Initiative. And it was released in 2002, like a bomb. It was dropped on everybody, and from that point on, I guess it was 1/6 or 1/5 of the female population that was on the HRT suddenly chopped down to half. So that means even less women got HRT. And now in the 2019, we have a lot of women that are going. The tail end of the baby boomers is going to be huge with regards to women going into menopause. And if you look at the information from Nurses' Health Study, the PEPI trial, HERS study, WHI, but you have to read the WHI properly because I think it was skewed. And I think I talk about this in my other video I did, DrRic tutorial HRT. So you have to read statistically read the WHI, and you'll understand what I'm talking about. I think that it was released, but the information, the data was interpreted the wrong way and fed to the public the wrong way. I really think that out of that study, we can I can be confident in garnishing one thing, that there's progestin that was used in the study, and that was synthetic progesterone. Progestin use probably increases the onset of breast cancer. Now, there have been other studies with progesterone. I like micronized progesterone, Prometrim it's called. That's a bioidentical progesterone. I believe it's made from yams. I think it's a little more subtle. I think that progesterone has its great properties, especially if you're suffering from hot flashes, FSH, thermoregulation is off. So I really believe that there are other things to do, but essentially if you want to take the big hammer and stop all those symptoms, bioidentical hormone replacement therapy, BHRT. And bioidentical is probably shunned in the medical community because there's pharmacists, there's compounding pharmacists. The compounding pharmacists have developed a niche since 2002 because a lot of people were falling off the wagon and really suffering, and unnecessarily suffering. Osteoporotic fractures, emotional instability, weight gain that led to other things such as diabetes, high blood pressure, heart disease, which led to other things after that, heart attack, stroke, cancer. So I think the trickle-down effect has really affected the general population and made people unhealthy. So, and they're suffering when in actuality, I believe you can do this without suffering. So How? There's a couple things. Again, the big hammer would be if you're not ready for that and you're really suffering, consider getting on bioidentical hormone replacement therapy. That's usually with a compounding pharmacist. I like to use Biest. It's without getting into the weeds, check out my video with Matt at Wholesome Health Pharmacy. I use estradiol a little bit, estriol a lot, about 80% estriol, E3, and about 20% estradiol, E2. I think that combination is pretty decent. E3 has always been more of an inert or less irritated, less side effect ridden estrogen, but those are your estrogens. If you do that estrogen as far as a cream in the morning, I think it will get in. Some people, I've heard some pharmacists say just put on the shoulders every morning or put on your hips every morning, that's fine. I like to rotate to different spots. Like I do with my guys, I'll say on shoulder day, put on your shoulders. On pec day, put on your pecs. On back day, put on your backs. On your legs day, put on your legs. Women can do the same thing. I think there's something called receptor fatigue that you should take into account. So you should move your spots. But I do the estrogen in the morning, and sometimes I'll even just give pure estriol, E3, in the morning, and no E2. Now, I think it should balance each other out because the E3 might not even work without the E2 around. So that would be the morning dose of your estrogen to fake out the brain and make it think that there's estrogen coming from an egg. Oh, here, an egg. So, and then I would do progesterone at night, only in the form of progesterone or micronized progesterone or prometrium. It is available via regular medicine or covered prescriptions, but it could be expensive, and it only comes at 100 and 200 milligrams. So I would usually start at 25 milligrams and work my way up, depending on how the patient felt, hot flash-wise, mood-wise. But it sometimes is a deal breaker when you have to spend so much money. However, I have sent other patients to my compounding pharmacist, Matt at Wholesome Health Pharmacy, and he's put together a pretty good, decent price. You'd essentially be paying about 30 to 40 bucks per month for progesterone at true Bioidentical, handmade. And yes, there are some of you are saying, well, there is batch to batch. It's not as accurate as something in a factory, but I think over the long haul, if you have somebody that follows the same technique, you should, and he's a good compounding pharmacist, you should be able to, and there's not that many other pharmacists there, should be able to give you good product over the long haul. So that's how I would do it. There are some standard estrogens. I think the Vivel Dot is my favorite. There's 2 little doses, and that usually is covered by insurance, and you just put it on about every 3 to 4 days. You take a new one and put it off. That also works. So that is the fast way. But again, like my men, if you do try to eliminate your symptoms and get on the science-y part of controlling when you go through menopause, that's fine, but you're going to have to probably stop it sooner or later. And one thing I can tell you from the WHI is that I believe that if you start estrogen or bioidentical hormone replacement 10 years after menopause, you do run a higher risk of cardiovascular events. So if you're going to start early, start it as soon as you notice it, especially after menopause. Now, I had a lady today who had a surgical hysterectomy. I don't remember why she had the uterus out, but they left her ovaries in. And the year she had her uterus out, ovaries are still working, her gynecologist put her on hormone replacement therapy, standard hormone replacement therapy. No progesterone because she doesn't have a uterus. That's what most gynecologists will follow. And that makes sense because if you have a uterus, you don't want to overstimulate the lining of the uterus with estrogen, so you have to give progesterone. But I still think there's other benefits to progesterone than just protecting from endometrial cancer. The calming effect of progesterone is so great. Also, it helps with breath. I do believe it helps with, in some cases, difficulty breathing, COPD, but the studies are very limited. But most of all, getting to sleep, getting hot flushes taken care of, and relaxing, almost to the same effect as Valium. So I would say there's other benefits to oral progesterone. If you can't afford the oral progesterone, don't have a compounding pharmacist around, you can make it in cheap form. You can always put it on your skin, but you're losing some of the benefits of calm. So other things to do, as far if you don't want to do the hormones, just say you have breast cancer, and I have one patient with breast cancer, and pharmacist was very reluctant to give her estrogen. I really wanted to say, you don't know your studies, but I couldn't argue with that, so we just gave her progesterone. However, there's other herbal things you can do, and I like something called the AM/PM perimenopausal formula, or AM/PM menopausal formula by enzymatic therapies. It's a combination of 3 different things for nighttime, 3 different things for daytime, just a little bit of them. But if you try this over the course of a month to 2 months, a little bit of 3 different things, it might move the needle a little bit as far as making somebody feel better. 2 of the ingredients are black cohosh and ashwagandha. Black cohosh helps with hot flashes. Ashwagandha also helps with calming, which will bring me to, and there's other herbs. You can do that separately too, obviously. You have to know your quality of herbs or supplements, and it should be guided by somebody who's very good with herbal therapy. And if you did get a good response with AM/PM formula, maybe after that, after 2 more months, you might want to get specific doses of the ingredients, like black cohosh, ashwagandha at a higher dose. The other things I like to consider, especially with a calming practice, is cognitive behavioral therapy. I think my average 50 to 60-year-olds are too stressed out. And when you throw waxing and waning hormones like this into the mix, they're really stressed out. So cognitive behavioral therapy, calming practice taught to you by a counselor or a psychologist also is very important. Part of that is the breath exercise that I always tell everybody to do, 4-7-8 breathing. I think it helps to control the vagus nerve, control the digestive system, control sleep, slow down the heart. I think it's very good, but even anxious people will, even the most anxious person will find that very irritating, to sit there in stillness and silence and do breath. So sometimes you need a coach, and I really say, if you can't get it on your own, and you can't maintain your own thing, whether you pray or not, or whether you take nature therapy, you probably should get a coach, a psychologist. Check out your behavioral health benefits with your insurance. The other things to do from outside going in, textiles. You shouldn't be wearing things that will make you keep in heat. You should be wearing things that let you evaporate. A lot of the textiles that we use in our beddings, in our blankets, in our pillows, in our clothing, in our pajamas, are for keeping you hot. You don't want that. So you want something that'll keep you cool. You can always, if you get too cold, just throw on the blanket, another couple layers that you keep down at your feet, and you can just move the blankets depending on your heat. So that might be helpful versus just being cold and putting on a bear suit, because you have to take that off, versus just a blanket up, another blanket up, cover yourself depending on how you want to vent. So that's one thing. Textiles are very important. There's also, I love this stuff. So this is China gel. China gel, I used to use this, I still do this when I practice yoga. Put it on my back, my sore spots. I usually exercise first with resistance and I go practice yoga. This is great because it's an evaporative, mostly menthol, but it cools. And when it cools, it makes you feel cold. This is CBD, this is there is a bit of THC, no, I think there is THC in here, I don't remember. But this is medical cannabis, mostly CBD. Let me just confirm that. I don't have my glasses. Should have my glasses. I don't know where they are. Can't find my glasses, they're usually on my head. But see what happens when you get old? Anyway, this has menthol in it. I first used this in Colorado, really awesome stuff. I find that when I put this on spots like my head, the back of my neck, shoulders, that if I do get to sleep, it really cools off. So the evaporative effect cools off. It doesn't smell too much like Bengay, and it will last for a little while. That trick of turning around your pillow always helps too, because for some reason there's always a cold spot underneath the pillow. So if you get too hot, flip it and it might cool you down. There's also pillows that I've seen that keep and trap cold. I just don't know what they're made of. Foam pillows, you might be asking for trouble with the inhalation of what you might be getting with your off-gassing, especially a new pillow. There's also other things you can do. That's topical. There's 2 forms of homeopathic. This is one. There's also Belladonna. Homeopathic pellets are very tiny. I think I've done a video on this. And technically they're sugar pills. But sometimes they're sugar pills, if you follow the homeopathy concept, sugar pills, if given enough, can incite an event, can incite a reaction. And supposedly, I have a couple patients on Belladonna. This one, also, it depends on if you have hot flashes with sweat or if you have hot flashes that are dry, and one works better than another. But if you're just continuing with the Belladonna, continue with it. Usually about 5 capsules or 5 small pellets about 3 times a day, or if you just want to do it before you sleep, works nicely. If it doesn't work after about a month, you might want to try a different homeopathic, or actually see a homeopathy doctor. The true homeopathy doctors don't like those Bibles that you find in Whole Foods where it says, you got this, take this, because it's more detailed than that. It's a very precise science, but I think for just attempting, if you have a little bit of a response, you might want to find a homeopathic doctor who knows his stuff. So the other thing to also consider would be magnesium. I think we're all a little bit low on the magnesium. I think magnesium calms. And it calms so that when you come up to that hot flash, if you're giving a speech and suddenly you start to drip, and then you get nervous, you're going to drip more. So again, the cognitive behavioral therapy will help with that, but magnesium also helps to calm too. Finally, if you don't, from the outside going in, if you don't have a good nutrition practice, I would highly suggest every once in a while you try to reset your circadian rhythm with a fast. I like the 5-day fast. It's worked great for me. It's turned on, I told you I'm going through andropause, but it's also turned on a lot of muscle responsiveness. So even though I'm going through this, I think by doing that, I'm turning on stem cells that's halting all the disease from progressing. I don't know if how long it'll last, but at this point in time, if I can beef up my shoulders, get more muscle developing, hopefully when time comes that the testosterone really decreases, I'll ride into the sunset and be cool. So fasting mimicking diet, I'll leave a link down below. Other things to do on the inside, number one, you got to avoid all the crappy stuff. So you got to get yourself off sugar. You have to. Whether it's additive sugar that you put into your coffee or sugar on the label. A bar of protein has sugar in it. Cereal has sugar in it. Some of the beans that you buy pre-made have sugar in it. So you have to be careful. You have to read labels. Sugar, gluten. I would really avoid alcohol, unfortunately, because it has an effect that just doesn't work right. Alcohol can make you sweaty. Alcohol will also screw up your sleep. If you drink, say, at 9 o'clock to get you sleepy, you might get to sleep, but alcohol's effect on the liver tries to chew that up, and by the time 6 hours has passed, you're going to wake up because all the alcohol will be gone, metabolized, either in your bladder, where you have to pee it off, or you'll be back to totally anxious and you need another drink. It's not good. So I think it might have a short gain, but you're going to have a long-term loss. So I would avoid the alcohol. Coffee during the day to wake you up would make sense, but that just increases the heat. And I don't think coffee grinds are good for reflux anyway. If you need it for stimulus, have a little bit, just keep it in the morning, and hopefully that's it. Don't do the caffeine that's in the bottles of pop. That's just asking for, that's too processed. I'd rather have you make your own coffee. It's cheaper anyway. And don't do the sugar in that pop. Also, I would stay away from dairy. I think gluten and dairy dairy is easy to stop because there are a lot of dairy substitute. Gluten, you got to do some research on. I mentioned keto earlier. I think it might be a good shock to the system, maybe to reset so it starts all over again. But again, if you're missing an egg, you're missing an egg. But sometimes the other organ systems will work better, which will bring me to, and no spicy food. You got to stop the spicy food. So it brings me to the other thing. A good doctor will always look at other possibilities. So we have to always look at hot flashes being related to infection. Lyme disease presents different and weirdly. So I would always be on the lookout for that. I don't think the 4 blood tests that I get are good enough. They're a nice start, but I have to go into the history taking and the prying of where you came from. I didn't find out with this one patient that I thought had fibromyalgia and a couple other things. It turns out she came from Connecticut and her father has Lyme disease, and I think I found what she has. So hopefully we'll be getting her to my friend Bob Tabali, and we'll be trying some IV antibiotics, and if it does work, we got it. So not everybody is fibromyalgia. Anyway, you always have to look for systems like infections. You have to look at your thyroid, because sometimes between the 3 glands, the thyroid, the adrenals back here on top of the kidneys, and then your gonads, the 3 are supposed to talk to each other. I think of them as triplets. So if you ever took care of triplets, they always they must have communication with each other because they all work to usually listen to the parent, but after they get old enough, they all work to push back the parent. So the 3 work together. When one doesn't work right, the other is supposed to pick up the process. And the adrenals can make some hormone. But when the adrenals are already shot, or when the thyroid's already shot and you lose the last organ or the last gland, you're really toast. So I would look into how the thyroid, I would look into and balance the thyroid. are looked into and balanced the adrenals. The adrenals are a little harder than the thyroid, but it's possible. Cortisol for the thyroid, Armor, Nature, Leo, or Cytomel for the that's for the thyroid. Cortisol's for the adrenals, DHEA is for the adrenals. So try to balance a good, healthy diet, get a good sleep going. The other thing is to not only for infection, but look at the heart. Sometimes hot flashes are actually a problem with the heart, whether it's atrial fibrillation or stenosis and or coronary artery disease. It should be checked out. And because that's the other thing is, as you enter into menopause, if you don't make any more estrogen, you are at risk, just as equal as a man, of heart attack, because cholesterol gets stickier. You will have collection of cholesterol in the blood vessels of the arteries of the heart. Possibility for heart attack is higher. And if you look at the PEPI trial and the HERS trial, it can be extrapolated that there was benefit to estrogen as far as prolonged protection against heart disease or cardiovascular events. So I think that all that in a nutshell, and by the way, fat. If you have extra visceral fat, whether it's here or extra fat here, fat by itself, adipose tissue, will also act as an estrogen secretor. So once that fat gets turned on, you can actually have more estrogen. It won't come from your ovary, it'll come from your fat. And that's a little bit weird. For guys, you get boobs. For women, you might have this weird pulsing of the gonadotropin releasing hormone and the FSH/LH, and then the estrogen from the fat. So it just makes things more complicated. But bottom line is, if you can postpone this pause, andro and meno, pause, and fix up your life. If you're not fixed already, maybe get a little healthier. Go from a category of totally unhealthy to maybe a category of not so unhealthy. Or if you want to, work your ass off, category of healthy. And then you can pull off those hormones, whether it's testosterone, estrogen, progesterone, or DHEA. Pull off the hormones and then just live life great. That would be the ideal for me. But obviously it takes a lot of planning to get there. And you have to do like 6 months at a time, because nobody can see that far in the future. Say, okay, you're going to be fine in 10 years. Well, take care of me tomorrow because I'm still sweaty tonight. So it takes some time, and that's again why I would highly suggest a behavioral therapist person to be on your team, in addition to an exercise physiologist, in addition to a doctor that's integrative. And everybody else on the block should be involved too, because you're going to have a little spike here and there. A good compounding pharmacist, if you're not watching this in Illinois, would be important, and there's a lot of them out there, so you just have to research. So hopefully this gives you a little idea of why women go through menopause, and you can see that it's not just in your head. There's a cycle of events that's happening that's putting you into these bad feelings. So if you can just bring down this crap, control it, and then get your body in tune, probably get through that and slide through and right into the sunset like John Wayne. Or Jane Wayne. So don't forget to subscribe to me down below. Put some comments down below on who your compounding pharmacist is, or what kind of bioidenticals you use, or which herbals you use. If you have a great set of herbals, I'd like to hear about it in the comments. Otherwise, I'll see you at the next tutorial.